Optimal health for high performers. This is the Health Upgrade Podcast with Dr. Nawaz Habib.
Hello, everybody. Welcome back to the Health Upgrade Podcast. This is Dr. Habib. I'm here with JP. How are you, sir?
A little hot. Just finished my run for the day, but I'm doing all right.
Amazing. You got back, got changed. We're good to go. And we are honored to be joined by Dr. Davis Brockenshire. How are you?
Hey, good morning. Thanks for having me on.
We are truly excited to have this conversation with you. We were connected through a mutual friend recently, and I've been following a bit of your work, and I'm really interested in your approach and kind of the way that you see health. And the idea of unlocking our genetic potential really does seem like something that we all need to be doing, at least if we're looking to upgrade our health and get our health moving in the right direction. And so what we want to first do is get a sense of who you are and what brought you into this kind of world of functional health, functional wellness, and optimization of your bodies. Let's talk a little bit about your journey. You've spent a long time in school. Let's talk a little bit about that first and why you were so interested in spending nearly a quarter century in school to figure out how to unlock your genetic potential.
Yeah, well, like JP, I'm a little hot too. I always do kind of a 30-minute hot tub sauna session every morning to kind of go vagal and incorporate parasympathetic tone to try and figure out what kind of day are we going to have? And, being a pathologic academic, that you're always searching for questions and answers, but there are no answers. There's just more questions. And so you're search. And then one day you get hurt. And as an athlete, I've been hurt so many times. I've counted at least 14 concussions. Don't hold that against me. But, if you're going to be at that highest level of whatever sport you're in, the difference at that level is less than 1% between competitors. So it's really a mind game, ability to recover, etc. And so all of my study really went into human performance. And that was all great. And things were working wonderfully. And then, you have kids and you realize, wait a minute, I can't kinesiotape asthma. What do I do with an autoimmune disease in a child? Where did this come from? Back to school, figured this out. And that took me down all the rabbit holes of functional medicine, functional neurology, kind of how our neurogenetics, if you will, our epigenetics of the nervous system are adapting and evolving to our new world through the umbrella of electromagnetic radiation, which, we're bathing in right now, but also this transgenerational piece of heavy metal exposure, particularly lead, mercury, diesel particles, envirotoxins. Oh my, we're all going to die. And we're not, because nature hardwired us to upgrade naturally. But the key is the pause. You can't always be go, 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 go. You need to hit pause in order for the upgrade to happen. And much like a computer, sometimes you actually need to restart. So what I've learned through this journey and primarily through working with children is, if we can create a pause on a regular basis and give the body the tools it needs to recover, restore, update, upgrade, then you've created an environment where your autonomic nervous system will anticipate a pause. And then you create a habit. And once you've created a habit, it's much easier to train that person. And you guys know it's, 2 weeks, 3 weeks to make a habit or break a habit. So it's not an overnight thing. We can't just, inject peptides into somebody and expect the miracle. So what are we at now? 31 years of working in this landscape. And I think, part of it is the chiropractic training, the philosophy of medicine. You see things differently. And I've looked at more than my fair share of advanced lab work to realize that, you can't test your way to health, but you can test your way to sickness really fast because you get confused. So I built, some basic frameworks we follow. But the end of the day, really what I love to see is these babies that, I was working on before they were born, doing preconceptual work. Then they're born and you're like, oh no, now what? And then you take them through the steps and then you go to their high school graduation and you feel like, you're at a police lineup and you can see your patients on the stage because they stand out at graduation. And so you have to play the long game, the generational game today with medicine and healthcare. And that's, one of my new projects is something that we call Fertile Earth. It's Fertile Earth Wellness. And I've working with some investors, we've created a system that's going to allow new parents to actually have the best shot at getting pregnant, making a new life, a healthy life. And that extends to people that don't want babies. Like, let's rebirth you. Let's unlock you. Let's upgrade you. And we can do that with some simple strategies.
So let's talk about some of those strategies,
Yeah.
especially, I'm personally fascinated, not as a medical practitioner, but as a scientist. I'm really fascinated by the interlacing roles of the immune system, the autonomic nervous system, and metabolism, even as far back as conception. And as you said, even preconception in the mother, getting her ready to be able to take on non-self and be the vessel through which that child grows. What are some of the things that you're looking at? I mean, I look at it from the autonomic nervous system standpoint and the immune system. What are you looking at it from, and what type of strategies are you looking to employ?
JP, you just nailed the perfect word, and that was vessel. So one of our tools, we call it the sacred vessel or womb repatterning. And if you get down and dirty, and we'll spare the audience about AMPK, NRF2, NF-kappa B, although we could get into the acronyms.
Let's do it.
Let's
I
do
love
it.
those.
So let's
We
take
literally do this every time. This
awesome.
is the conversation we have. So
All right, 80,000 foot view over a female. All right, so we got to go back to grandma. Did grandma smoke? Was grandma abused? Was she in a war? All these things. And I'm always shocked at the amount of abuse that the grandparents had been through. I say the grandparents because mom's the one having the baby. So grandma imprinted her autonomic stress tone into her follicles, which means mom received that code, but the code didn't get activated till mom had a baby. So it's always a second generation piece. So whatever we're looking at with mom to be, we have to talk about grandma. What did she go through? What was she up against? What did you inherit from an autonomic patterning point of view? Then are you, expressing those patterns in your life? Metaphysically, like, how do you handle stress? Do you think you're good enough? Are you worthy? Are you walking around with...
But it's physically.
Yeah,
It's physically in the epigenetics.
Absolutely.
I mean, you're talking about is epigenetic imprinting.
The VDR SNP for vitamin D receptors is usually downregulated due to a latent virus, usually Epstein-Barr or herpes. And now you overlay infections like Lyme or Mycoplasma pneumonia, which is epidemic. So it's downregulating other SNPs like COMT, which has to do with stress management. So what's happening as we go through in today's generation, and I'll just call it, N3, generation 3 or F3, is these people, let's say born after 1990, were ready to have babies. Their nervous system's not, because they missed out on the pause because they were born into a state of threat. And then they just dove into dopamine, and they can't unwind that pattern. So when we talk about womb repatterning, we remove them from their life. We do some of this transgenerational work. We do viral detoxes. I focus on endotoxemia because a lot of these women, they've never had normal bowel habits. And so we start pulling the endotoxemia out with good binders. We look at things like bile acids. A simple medical test. You run a stool sample, measure the bile acid breakdown. A lot of people don't make good bile acids, which means now they're walking around with a host of all the wrong bugs in all the wrong places. Nature's going to say, hey, now's not a good time for you to reproduce. You're not having a party yet. So I call it the prenatal party is what we've got to get an invitation to. And that's a cool party. Now you're thinking like, whoa, we got masks on, there's funky music, a little Despacito, and then the magic starts to happen. But you can't make the magic in a dirty soup. So I call it clarifying the terrain. So obviously there's some detox, there's some mindset work. Everybody wants to use red light. Well, go ahead and use red light. You're going to activate mitochondria, but what are you going to do to clean up the mess? Detox drainage. And then mindset. How many concussions has this person had? Did they play soccer in high school? Did they get hit in the head while they were ovulating? Because now that trauma pattern's locked in. And so every time they ovulate, they reproduce kind of a closed head injury pattern. So all of these things have to be unwound, and it doesn't take long. But once the person starts to figure it out, they're like, I get you, bro. I'm ovulating. I'm not ovulating 2 days before menses. It's actually starting to happen. I'm getting an LH surge where it's supposed to happen. I'm learning about my body. I'm listening to my body. I understand what happens at ovulation. Fluids change, temperatures change. All of these things they don't teach women. And now mom's ready. And then it always happens. Mom will say, yeah, I dumped that loser. I need a new sperm donor. So they've had all of this aha rearrangement of their consciousness because they're finally healthy for the first time in their life. And the person that they were biologically attracted to is no longer attractive. And so nature takes over, and anybody smell those pheromones, and now they're attracted to somebody new. And then it's dad's turn. And you look at these guys and you're like, dude, you have no testosterone. And you're walking around so toxic to all these things that it's not that you're not making sperm. It's just the sperm you make are confused. They have no tails. They have two heads. They can't make the journey. And, we just, hey, let's dive into fertility right out of the gate. Why not? But that's why, right? We're looking at the autonomic tone between a male and a female from preconception until fertility. And unfortunately, nature kind of set us up for that sweet spot between like 16 and 34 of reproduction. That's when you want to have a baby for the best opportunities epigenetically. But we don't do that in the Western world. We, wait till we're ready and financially secure because kids cost so much money. And you know what's really expensive? Fertility treatments. So if you wait too long, it's going to burn you in the end. And then you're going to spend a lot of money with people like me to try and help the children recover from, cosmic radiation and all that stuff. So I'm all for, good, strong family units, good communities, have children relatively younger if it's feasible. And that gives that generation the best shot at being the best they can be if you can't. And our record in the practice is 52. So I helped a mom have a baby at 52. Kid's awesome. Unbelievable. Now she was German, so she came from haughty stock and she was told she'd never have a child. She never found the right guy. When she found the right guy, and we did some tuning. So anything's possible if you understand the nuances of autonomics, the microbiome, prior TBI, brain inflammation, environmental toxicity, and just kind of how to hack, some of these mechanisms.
Yeah, no, one of the big things we've seen also is premature ovulatory failure, which is about 40% of female infertility. And that is something that just simply getting your parasympathetic recovery mode going, getting into that habit of being in parasympathetic recovery mode, it just literally melts away. And people who never thought they were going to be able to get pregnant. We had, a couple of years ago, we had a woman who had Ehlers-Danlos, and she never thought she was going to be able to get pregnant. She started really focusing on parasympathetic activation, and she got pregnant. So it's one of those wonderful stories you hear about, but when they start to rack up, what do they say? The plural of anecdote is not evidence, but it can be pretty convincing.
If there's a billboard that says Dr. B got me pregnant, they always joke about that. I'm like, don't joke about that. You're going to be in trouble. But it's true. After 31 years in practice, we're welcoming in the grandchildren now. And as you know, like with acronym soup, with EDS and POTS and EBV and HSV and LMNOP and all of that, you see the degradation of the genome over time. But this parasympathetic tone, it's so easy to describe. I just tell people, look, I need you to hurry up and poop. You can't. It's physically impossible. You'll rupture something. And the same goes for reproduction. You can't hurry up and have a baby. The minute you stop trying, it happens. And conversely, right? You spend your teenage years saying, please don't get pregnant, please don't get pregnant, please don't get pregnant. Well, that's sympathetic because you're worried about it.
Yeah.
So,
You've hit the nail on the head there. It's so interesting how as people, when we force these things to happen, we're constantly we're grabbing the sand by and squeezing as hard as we can, and we realize the softer we hold it, the more sand we can actually hold. The sand doesn't fall out when you're gentle with it, and so it's this idea of not forcing your health. You mentioned something earlier, and you kind of just glossed through it, and I want to make sure that people hear this important piece. You mentioned that people, when they start working with you and you're working on that fine tuning, that first step is they're actually starting to listen to their bodies, listening to what the body is trying to tell them, not fighting it, not allowing those messages that come in to be negative dictated questions that are constantly rolling around causing some sort of anxiety in their head, which is such a common issue that I come up on clinically when I'm working with people. Talk a little bit about some of the tools, those practices that people can start to utilize to start listening to what their body's truly trying to tell them.
Well, in today's world, with all the wearable technology, it's a double-edged sword, but it gives you the ability to see what your autonomics are doing at rest. And then if you're, really hung up on it like me and you're running multiple devices just to compare the two or three, you can see how different body metric data is being viewed by different AI algorithms. So, the joke is the Aura Ring is very passive. Oh, great job today. I'm so proud of you. You went for a walk. And then my Garmin is like, you are very lazy. You need to get out of bed and 10 miles will do it. I'm like, 10-mile run? Okay, stop yelling at me, Garmin. And then Apple's somewhere in between, So with the body data, we got HRV, we got temperature, resting heart rate. We're looking at deep sleep, breathing patterns. All of these are available. People that suck at deep sleep, they just never go into parasympathetic tone because they're freaking out. And this is the PTSD piece. So the first thing I do when working with a patient is assess for PTSD. Simple test there is classic Romberg's test. I have them stand on one leg, see if they can balance. Can they balance? Yay, you can balance. Now look up with your eyes into the back of your skull. And if they fall over, there's embedded trauma, usually in the corpus callosum, which is shorting out the right brain. So the right brain and the left brain can't communicate. So the left brain says, hey, is everything okay? And the right brain says, I don't know what you mean. What is okay? And so even when they're sleeping, they never feel safe. They're waiting for that next trauma. So nutritionally, the first thing we layer in is lithium orotate. And lithium, as if you look at any of the literature today, it's protecting brain cells. It's down-regulating glutamate excitotoxicity. It's reducing inflammation in the brain. First thing they say after taking 5 to 10 milligrams is, whoa, what just happened? Why am I so sleepy? Like, that's your neutral state. These people have been running on nervous energy. And when you remove the nervous, they're exhausted. Now, one mistake I see people make, and practitioners, they're good for this too, is they want to lean on adaptogens. They want to dive down the botanical rabbit hole and start hammering ashwagandha, rhodiola, and all these adrenal type herbs. But unless you address the parasympathetic tone first with minerals, magnesium orotate, magnesium glycinate, magnesium threonate, those are good ones too. You can't expect the plant to calm your butt down if it doesn't want to. So when it comes to functional nutrition, it's all about knowing kind of what tool to use at what level, what time, and where are they in life? When are you going to sequence it in? And that's why I like to start by eliminating the PTSD type trauma pattern. And let's find out what really makes the person tick. Then the case opens. So PTSD is the first step. And that's just with eye movements. I'm a big fan of brain tap. I like doing that in between visits. So if somebody's flying in to be treated for a week, we do brain tap every day. We do PEMF. I've got some giant cannons of light in the office, like 78,000 watts of directed light that we can do for different purposes. I mean, if that doesn't calm you down, you need a therapist. So we're usually pretty successful. It's like 1 in 1,000. Do I need to refer to EMDR or something like that? But that's kind of step one. Step two, we look at poop.
Yeah, this is very much a similar approach to how I see things. And we always want to start with kind of how are people seeing the world, right? Very much what are the stressors and what are the scuffs on the lens through which they see the world. And this is where the PTSD mindset piece really comes in, because we can see the world either objectively or there's scuffed lenses through which we then see that it's a threat to our survival. And if we've been traumatized or if we've experienced major stressors in the past, things that are objectively not going to cause an issue or a survival threat to us, we may see it in the way that it will. And what that does is it takes us out of this feeling of safety. Safety being that major driver that turns on parasympathetic activity, parasympathetic vagus nerve tone. When we're stuck there, what that does is it drives constant sympathetic activation. And this is why you're absolutely right about this. When people are throwing the adaptogens in and we're saying, it's hormones, guaranteed it's your adrenals or you're burnt out or whatever this is. And half the people have the exact opposite intended effect because they're taking ashwagandha or rhodiola and it's doing the opposite. It's actually stressing them out more, or it's having almost no effect. It's because they haven't worked on that nervous system tone or how they see the world first. That is so huge and so powerful for people to understand that we need to start with this. You can't heal when you're stuck in sympathetic state. This is like the overarching theme of everything I talk about is we need to enter parasympathetic state for that to occur. And then, yes, let's now go look at your stool. Let's go look at your microbiome. Let's go see what's happening biochemically within your body. But if you see the world as being a negative influence and constant emotional and psychological stressor, everything is going to be primed towards sympathetic, and that healing capability is just not going to be able to take over.
Well, and as doctors, we're guilty of it, because we get
100%.
hooked on these pathways. Holy crap, everybody's got Lyme. And then you're like, no, actually it's mycotoxins, but it could be mono. I'm pretty sure it's mercury. Well, wait, it's a concussion. Oh, and you're just, as a practitioner, you're just on this loop of trying to figure out what it is instead of asking, well, wait a minute, stop focusing on what's wrong. What's right? What actually helps this? Like, what are we working with? And it's this concept of salutogenesis, where as medical practitioners, we need to start looking at what does this person have going for them and build on that instead of always focusing on, oh, dude, you're so screwed. You've got an abscess in tooth number 2. Did you know that's related to breast cancer? Oh, man, just stop. Like, back it up. You just traumatize that person and they'll never go parasympathetic,
Right.
So JP,
You hit the
nailed it.
nail
He's
on the
like,
head there.
we got to go for a run. I mean, you went for a run this morning, right?
Yep.
Yeah,
Every
you got to
every
get the
morning.
blood moving. And that's just a habit, a successful habit to do every single day, that if you don't move it, you're losing it. And a lot of endurance athletes, we go parasympathetic when we're in movement. If you stay in zone 2, you start flirting with zone 3 heart rate and you're like, maybe I'll go a little faster. What's zone 4 feel like today? So one of my old coaches, Phil Maffetone, who's just a hoot, and he's in his 70s now, and he's all about the power of sound healing, man, and check out my hair, dude. Let's play guitar. We're going to go vagal. But he was one of the original guys who did applied kinesiology. He wrote the textbooks on sports medicine, and he was an ultra endurance runner. And, he's a big proponent of aerobic training, zone 2, flirt with zone 3 type stuff. But the reason I bring this up is my research and work with endurance athletes is when a runner falls in an event, and let's say they do bump their head and they kind of shake it off and they get up and they keep going, that moment of trauma is now getting imprinted with running. So the worst thing you can do if you bonk your head in an event is return to that activity immediately. You got to sit down and knock it out, breathe through it, reset your brain about 15 minutes, then return. If you jump right back into that movement, whether it's running, cycling, football, hockey, soccer, it doesn't matter. You're now telling your brain that this is the only way I can be safe is to keep going. Run, Forrest, run. And now one day you can't run and your mind explodes and you have a panic attack and you don't know what to make of it. And now you're stuck in that trauma repatterning. So the good news is the neuroscientists are coaching the coaches and the trainers and saying, if you suspect concussion, they got to come out. You have to repattern them. And we can do it with eye movements. That's why in the NFL, you see guys on the bike sometimes when they come out and they're watching the trainer move their thumb around. They're resetting their brain so they can go back in. Holosync, all these audio tones, binaural beats, all of these technologies are kind of circling the wagons of trauma and anxiety. But what you can do with your technology is just pattern interrupt us immediately. Come here, kid. Zap. Oh, what happened? And then just go, hypotensive and then have some electrolytes. Then they're back in the game.
No, there's no question. It works very, very quickly with electricity. It sort of doesn't require voluntary participation, if you know what I mean.
There's no placebo. It works.
No, not at all. It works and it's going to work whether you want it to or not. But, we talked about the preconception period and what you need to do. We talked about what you do in utero. Let's talk about what you do with children after they're born. As you said, you want to get to the high school graduation. It's like the police line up, that's one of mine, that's one of mine, that's one of mine, because they're different. What is it that a childhood that is marked with that level of discipline around getting back into a parasympathetic state and learning the right foods to eat and learning the importance of sleep. I mean, they're still kids. So that, sleep is the enemy. I've always said the definition of adulthood is when you no longer need to be told to go to bed. And then it's, what is it that you're doing that you've seen now over dozens and dozens of children growing up that works? And what are the things to avoid? I mean, we can talk about vaccines. It's not a third rail on this podcast. I know the difference between an antigen and an adjuvant. Okay. And that's what people need to realize. So,
well, this is JP's fault. We're going to go down two lanes.
Let's go down the rabbit hole.
Yeah, but we're going to, I always preface every conversation with data driven. We're going to stick with data. Now, you can have emotional mindset around data based on experience, but it's still data. So if you're holding your hand over a lit flame, you can ignore it, but you're still getting burnt. It just depends on your impression of pain. So when it comes to children, that's a good example, holding your hand over a lit flame. There's two roads that we have. So mom has a baby. Now let's start with that. How many children in the Western world are actually born through the river of forgetfulness today? They don't have a vaginal birth anymore. The majority is now C-section. So that causes issues because the baby's microbiome didn't shift as it was going through the vaginal canal. It was removed. So essentially, they're starting off behind the 8-ball with a very inflammatory microbiome. So you're going to see C-section babies prone to autoimmune patterning unless you seed their microbiome either with a culture from vaginal secretions or some probiotics, etc. Some of that gets wild beyond the scope of today. But from that point, you're dealing with a hyperactive immune system. So these are the kids that come to me and they've already got things going on. An easy case would be eczema, asthma, they're on the spectrum, something like that. Worst case scenario is they're disabled.
But a lot of that can also happen in utero. With maternal immune activation.
Yeah, so third trimester particularly.
Exactly. So you get that immune activation where their immune system's dysregulated from in utero. But you're absolutely right. It can happen as a result of the microbiome not being populated properly at birth.
Well, and the stress of the C-section and what's going on there. I mean, there's no ritual process of bringing that baby into the world. And then you have the stress of mom. And then she's like, what did I do wrong? I just had surgery. They're full of hormones. They're full of anesthesia. So anyways, that's the kind of child that I get to see. And we go down this road. And that road is the repatterning of the immune system, bringing things back to a Th1 dominant state so we can have a healthy immune response instead of just a crazy immune response. And you'll see that as the child gets older, they'll get sick, they get better. They get sick, they get better, instead of going full-blown pandas and trying to rip their ears off. And so it's all about immune modulation. And obviously, we're working on GI response, but we're using other tools, fixing a lot of the deficiencies, teaching mom and dad, hey, you're actually the parents, not the friend. And so you make them take this stuff. You make them eat this way. I don't care if they're mad. Yeah, I had a talk with a mom yesterday whose her 6-year-old had the absolute worst IgE allergy panel I've ever seen. I said, your daughter's not dealing with behavior dysfunction. Her brain's itchy. So what is she eating? Oh, well, I cook for her. I said, okay, but what does she eat every day? Oh, every day she gets one large McDonald's French fries. Well, we got to stop that. Well, if she doesn't get it, she freaks out. I said, well, then we're going to have to break the habit because you're turning that child into an addict. So that's kind of the worst case scenario on road 1. Road number 2, you have a great vaginal birth. Maybe there was trauma. We fix all that chiropractically. And then you put them on the road to health, which is you've got playtime, sleep time, eat time. And in the first 2 years of life, it's basically eat, sleep, poop, repeat, and play. JP brought up the vaccine story. I mean, how many more children do we have to write about at about age 1 when they received an MMR and then just stopped talking and went catatonic? And we can draw out why that happens. Here's what bothers me about that story. It's not political. It's not pro-vax, anti-vax. It's just science. If you can predict who will be injured, then you should know better.
Yeah.
You know?
And if you've done studies outside the United States where stacking 6 vaccines in one 30-day period shows, an astronomically higher level of neurodevelopmental problems, and then not stacking it doesn't show that, okay, is it strictly cause and effect? No. But is there some protective measure that you can take that will have an outcome that we're looking for? Yes. So I look at it and I get frustrated because I sit and talk to people who work with kids who have autism. And I say, okay, so tell me, what percentage of the kids that you have were on a normal trajectory of development and then had a regression versus a child who never was on the right trajectory and sort of had autism from jump ball? And the answer is 98% of them are of the first variety, where they were on a totally normal trajectory and then had a very discrete moment within 24 hours where there was a massive regression in neurodevelopment, and they're stuck. And it's, I mean, that is, there's just no way you can say that that's a normal trajectory. It's a discontinuity.
It's predictable.
So, anyway.
It is entirely predictable.
And adults will show a similar pattern. It's just not as extreme. Good example is one of my clients. He got deported just by accident. Didn't know he got fired. He was out of the country, came back into the country and got deported. He's like, oh crap, I got to go to Toronto. I don't want to go to Toronto. Okay, well, we'll pick on Canadians. So he has to go to Toronto. Luckily, his wife is American. So they begin the process to bring him in on a spousal visa to get a green card. And in order to do that in the United States, you got to do your immigration physical. Now, what you don't know is he is in remission recently for rectal cancer. So we got him in remission. He's doing great. He's doing everything he needs to do, but he's very high strung. So during the immigration process, he has to get his physical. The physical requires a whole set of vaccinations. So in that physical, so you can imagine his mindset, he's very stressed out. He's trying to get back to his family. He's still, trying to beat rectal cancer. They give him 6 childhood vaccines plus a COVID booster in one sitting, though. It was just delivered all at once. And, he got his green card. He was able to come back and he went in for a 3-month colonoscopy. And guess what's back? Back again. There's the rectal tumor. So we strategized and worked with the surgeon and we got it all cleaned up. But like I always say, where are you in that moment when you receive that medication? It doesn't matter what kind of medication it is. If somebody's going to give you a drug, where is your mindset in the moment? Even with the GLP-1, somebody's going to inject you. If you're the one doing the injection, you almost want to have like a mantra to say, I love myself. I love the way I am. This is going to help me be the best version of me. Let's upgrade my potential and then inject. Don't say, oh, you fat slob, I can't believe you're doing this. What's wrong with you? And then you inject. Your nervous system will perceive that injection as a threat and then activate all the wrong things.
Context matters so much in every aspect here, right? Like, where are you located? What is your mindset in this time where you're taking this on, and why are you doing it, right? Are you doing it with the intention of coming out of it with something positive, or are you trying to get rid of something negative? And I loved what you said there earlier. Let's stop focusing so much on the negative or what's wrong with this person from a practitioner standpoint and from a personal standpoint. Let's stop focusing all the attention on our like a negative view of our weight or a negative view of our body's functionality. Let's start focusing on what is working and build and grow on that. It's such a unfortunately uncommon way of looking at it, but I think it's such a powerful way of addressing each individual and personalizing care for each individual. I always say to my clients that the doctor's job is to distract the mind while the body enters healing mode and does the healing itself, right? We can throw all the herbs and medications and supplements and everything
Peptides.
at it, peptides, you name it, right? And ultimately your body is going to do the healing. It's your immune system that needs to be re-regulated. It's your nervous system that needs to send that signal out. And if those systems are not working well and integrating well with the microbiome, integrating well with your lungs and your oxygen and your CO2 tolerance and all of these important factors that are internal, endogenous factors, then what good is it going to do? You can't enter that healing mode. My job is to help you learn, listen to it, and distract your mind from the negative so that you can enable and bring in a lot of that positive.
Find your breath. Yeah. Another point to JP's comment about, babies and what do we do? There's this expression we say, I slept like a baby last night. When you watch a 2-year-old just pass out, they don't care what position they're in. And you're like, oh my God, if I slept like that, I'd have to see the chiropractor 12 times. But you look at their breathing and you just, that is the ultimate expression of parasympathetic tone. It is like system in reboot. But then
it's so funny you say that.
I want to make that.
I literally have to share this with you because you just said it and the timing was exactly perfect. We had a friend over on Friday and I showed them our vagus nerve stimulator and I had her use it. And she complains that she's always a light sleeper and not able to get great sleep. And she messaged me the next day, just so impressed. And she literally said, word for word, I slept like a baby, didn't need as much, and slept so deep. I feel so energized and refreshed. I was pulling it up, but I can't find exactly where it is. That said, that's literally what people hope for, is to just pass out. And yet we're sitting here in this anxious, constantly sympathetic baseline state that takes us out of the ability to sleep so effectively. So just thought I'd throw that point in there.
And we all have a nature deficency.
Yeah.
And the Japanese have proved it. I mean, they're selling tourist packages to go into the forest. And, I don't know how old you guys are, but judging from you, we've been around, we've seen the woods. We remember the woods. We remember the jungle. And the kids today, if you put them in the woods, they love it. And the Finn, I guess we'll call them, we got Finland, Denmark, Norway, and they're all kind of like fighting each other right now. But they have a system, they work in school that is, it's driven from the Sami or the indigenous people of the North, which is, let the kid figure it out. Oh my God, don't go on the ice. The ice could break. Well, they'll figure it out. If they fall through, they fall through. We'll pull them out. Then they remember. If you're training children to be afraid of everything, then that's what's going to happen.
This is a remarkable parallel because it's not just children, it's adults. There's a story that in Denmark, there was a treacherous road where there were accidents all the time. And so the government decided that they needed signage. So they began putting up signs, warning signs. And as you would imagine, it didn't change the number of accidents. In fact, the number of accidents got progressively worse. And they kept on putting signs up, kept on putting more signs up. And the accidents got worse. More people were dying on this stretch of road. And they actually considered just tearing the road down. But somebody said, let's just remove all the signs. And what they found was that deaths plummeted because people had to start taking responsibility for themselves. And they started having to judge the road not based on the signage that was there that they could ignore, but they had to actually think it through. They had to be responsible for themselves. And so they decided, signage is got to be used sparingly. So advice is great. And we always say, experience is a hard teacher, but fools will learn from no other. But the lessons you learn from experience are ones that you never forget.
That's why I love a panic attack. When a big burly man has a panic attack, thinks he's having a heart attack, goes to the hospital, knows he's going to die. They're like, no, it's just a panic attack. That changes their trajectory because they don't know what happened, but they don't ever want to feel like that again. So they're making like a neurologic contract. Dear God, don't let me go through that again. And then you start working like, well, what happened? What led to that moment? Because those are major pivotal shifts in life. It's like the first day of school. It's stressful, but only if the parents really make it stressful. Like, hey, go ahead, see you later. You just dump them. It's like learning how to swim. Just, maybe it's too Gen X of me, but we're just thrown in the pool. If they'll figure it out. If they don't figure it out, then, you yank them out.
Gen X with you, man. It's
Yeah.
like, they had to tell us, they had to have literally advertisements that it's 10 o'clock. Do you know where your children are?
Right. I taught both my children how to drive, which probably wasn't a great idea. But the biggest stress today is kids are like, what if I fail? What if I don't get my license? What if? I'm like, what if you kill somebody? Oh, yeah. I would worry more about your skill set than I worry about your test taking ability. And so I put both kids in the ditch on purpose. They didn't see it coming. I'm like, what are you going to do? They're like, I don't know. I said, then now we troubleshoot. Let's figure it out.
Now we learn.
And both of them are incredible drivers who have been through some of the worst driving conditions. I would never drive in that stuff. They do it. It's no big deal to them because they've got life experience to handle. Hey, pay attention. Put the phone down. Those speed signs for a corner. Yeah, those are just recommendations. Like play it by ear. Things change. And when you look at kids who weren't taught how to drive, they just learned, playing Grand Theft Auto or something. Wow, are they going to kill somebody? And that's not good. I mean, we're not interested in creating problems. We'd like to create a flow state in everybody so you can stay flow state when you're traumatized operating a vehicle and let your autonomics take over. Because if you don't have a functioning fight or flight response, when something does happen, you have no response. Nothing happens, and either you don't crash or boom, you're in a nightmare.
Part of stress resilience, we talk a lot about stress resilience on this show, and we talk about it from the standpoint of getting back into a parasympathetic state. But it's just as important, and we should spend more time talking about it, being functional in a fight or flight state.
In the worst
because
state.
You got to be comfortable in that state. You got to, it's just like going out for a run. If you've never run before or you don't like running, you go out and you're a half mile into that run and your heart rate is going and you're starting your breathing heavy, et cetera. That's going to trigger you to panic. You're going to freak out. You're not going to like it. It's going to be uncomfortable. But if you get to the point where, hey, I do this every day. I do 10 miles every day. I know what it's like. I'm going to be comfortable in that state. So when I get to that point where my heart rate is, elevated and my breathing is labored, yeah, that's my flow state. I like that. I know that it's temporary. I know that I can get out of it. I know that it's just part of the process. So part of stress resilience isn't the recovery, because that's easy. Getting back into parasympathetic and relaxing, I recognize for some people that's difficult to do. But when you do it, it's not stressful by definition. What you need to be is resilient in the stress. You need to have a big window before you move into that freeze state where you panic and you can't function.
You got to be comfortable being uncomfortable.
And most people don't understand what that means. And it's because they've been either so sheltered from going into those stressful patterns that they don't understand it. And it's not a familiar feeling. And because of that, it's so incredibly uncomfortable. And what they have then is this hyper unfamiliar amygdala fear retraining response, right? They go into a fear mode. And that's something that we need to start to train. And that's where exercise and physiology really kind of work together to help you drive that, because you're physically driving your body into a sympathetic state and teaching yourself how to flow in that state. And Davis, you brought something up earlier saying that when you get into that zone 2 state, if for a lot of athletes, when they get into that zone 2 level, they're in a flow state. They're almost going full parasympathetic physiology, even though they're physically in a sympathetic state because they've gotten so familiar being in that state. Can you talk a little bit about that on the performance side of things? Because you're a cyclist, I ride as well. So this is so cool, because how do we teach kids to be able to go there, understand what that feeling is, and be able to automatically shift through those physiology states?
So the media trains the younger generation that you have to be all in, maximal effort at all times. And that's counterproductive. And what we know about human physiology is if you build this massive base of aerobic capacity, your ability to be in movement at an accelerated pace, but in a calm state. So that's zone 2. For most people, it's when you're working out and you're starting to breathe, you're like, yeah, I'm working out. Okay, but I'm not really doing anything. That's kind of your zone 2. And if you train in that state regularly, you're training all systems of your body, digestive, cardiovascular, neurologic, all of it, to embrace that state, which builds this huge reserve of mitochondria. So phase 2, zone 2 is all about mitochondrial genesis and vascular genesis. You're creating more blood cells, more blood vessels, more mitochondria, more energy. So after 3 to 4 months of doing that, when it's go time, it's not that big a deal for you to just hit it. And you realize, whoa, I'm actually doing more work with less effort. So our current reigning Tour de France champion, Tadej Pogačar, you got to love Tadej. When you look at his data, he can push 435 watts on a bike at his functional threshold, which is where his body starts to come out of zone 2. So he can sit in a comfortable state and tell jokes where the average human would be dead. And his compatriots are having a hard time breathing, and he's there just singing disco and telling stories. And they're like, how are you doing this? Because he's taken a long view on training, year to year to year, developing this massive aerobic base, fine-tuning his body for one singular purpose, produce power with the least amount of oxygen. So if we all do that on a day-to-day basis, and that's why walking shows such good results overall. You go out and if you can get an hour of walking total in a day, you're basically zone 1, 2. You're cleaning the body, you're developing mitochondrial genesis. If you're in high school and you're trying to get better in cross country, slow your roll, develop your base, because every single testimonial when it comes to marathon training is slow down when you train to run fast when you race. It's counterintuitive, but if you look at the Canadian Cycling Association, they do the same thing, and they measure blood lactate thresholds regularly. And we can do that now, which is way easier. But they'll know how hard to push a person based on their lactate percentage, because every day is different. Some of us respond different to stress, and that's the resilience factor. And I think people are too damn hard on themselves. Like, they got to get up at 3:30 to train. Why? What are you training for? Well, I got to work out. Why? Well, because I got to stay in shape. There's a lot of other things you can do besides getting up at 3:30 in the morning and doing HIIT training for an hour and a half. No wonder you're hurt, sick. No wonder you have lupus. You've just destroyed the way your body rebuilds itself. So it's okay to build in active rest phases in your training cycles. And this time of year, we're kind of at the end of the year. All my pros, I'm like, it's slow your roll time, man, low and slow. In the US, we got Thanksgiving coming up. I want you guys to, play around with some cocktails, figure out, do stuff you never do during training season. Embrace life, try some new things. It's okay to have one donut. You're not going to die. You might feel like it because you've never had one, but you don't know till you try it type of thing. So live a little.
It can be hormetic.
Yeah,
honestly,
it's hormetic. Exactly.
It's not good for you. It's not something we want to make as a habit, but it's going to stress you in a little bit of a way. It's like having one drink. We all have experienced the fact that if you've never drunk before and you go out and you drink, 5 drinks, you're really drunk. But if you go out every weekend and you're having 2 or 3, well, then that time you have 5, you're not that drunk. Okay. Because your body has learned how to accommodate that, even though it's a toxin, even though I'm not in favor of, and I'm not drinking, there's a truth to the fact that you are building up a tolerance to it.
It's ritualistic.
Yeah.
So a lot of people say, well, I start my day with coffee and end my day with wine. Okay. Before I give you the whole speech on poisoning, let's talk about what kind of coffee. What's that got to do with anything? Well, are you going to Tim's every day? Going to Dunkin' Donuts? Like, don't do that. You should be looking at coffee as a medicinal food. And what is your extraction method? And, the whole coffee snob thing. Fine, you got that. So was it really the coffee you wanted, or was it all the crap you put in your coffee? No, I really like coffee. Well, me too. So enjoy your coffee. There's benefits. Great. The wine. Well, what are you drinking for wine? Whatever's open. So what if we replace the wine with bourbon? Oh, that'd be great, but bourbon's bad for you. So you're just looking for a sedative effect. Okay. But if you are, if like me right now, if you're sitting in your wine cellar surrounded by all your friends and bottles, maybe you have a relationship with the polyphenols and maybe you are only having 4 to 6 ounces as part of your ritual of the day. But if you're having 3 or 4 old fashions at the end of the day, your brain is looking for a way to unwind. And that's, I think, where your technology comes in. So from an alcoholic's point of view, what you guys have produced, that's a game changer. And talk more about how can we pull people out of that addictive patterning?
Yeah, no, you're absolutely right. Vagus nerve stimulation has the ability to, on multiple levels, help people with an addiction problem. First off, the neuroplasticity, changes that take place with vagus nerve stimulation are really important. So, just the habit forming, you can break habits more quickly with that. There's also especially with the harder drugs like opioids, et cetera, there's the inflammation, the microglial activation that occurs as a result of using those drugs. So a lot of times the withdrawal symptoms are actually symptoms that are created in the central nervous system by your immune cells, and we can quiet those down very rapidly and relieve the withdrawal symptoms. Because when you go in for rehab, it's getting through that first week that's so critical. And that's where, 80% of people fail. So getting through that first week is all about the withdrawal symptoms. And if you can minimize those, then people want to get off those drugs. They do want to, but they physiologically can't because of what the withdrawal puts them through. So if you put them on a vagus nerve stimulator during that period, they don't experience the depth of agony associated with those withdrawal symptoms because it literally isn't happening. The withdrawal literally isn't happening because the withdrawal is just being generated by those microglial cells. So they then can live up to what they want. And that in and of itself is reinforcing because now you have the ability to break it. You feel better about yourself. You don't feel like a failure for having, fallen back into your habit. And that alone can carry people further. So
I think there's even the power of vagus nerve stim on the astrocytes and supporting the blood-brain barrier, essentially allowing the detoxification of the brain to happen more effectively and not allowing more toxin to enter, and the settling of the aquaporin channels. And then clinically, what I see is a lot of people go into these addiction behaviors through some sort of stressor. There's some driving stress that pushes them to want to experience that boost of dopamine that they then become addicted to. And what vagus nerve stim has been shown to have really powerful effects in, particularly in a clinical sense, is lowering that stress burden, experiencing a physiological shift so that you're not in that stress state as much or as often. And what that does is it says, okay, I don't need the dopamine hit right now. And it slowly decreases the urgency or the need to go and get that. So in combination, it's working on the psychological side and the biochemical side.
Because it's increasing your serotonin production. We talk a lot on the pod about, okay, where's serotonin coming from in the brain? Well, it's coming from tryptophan. Tryptophan is the precursor amino acid that's used to make serotonin. Well, it's not the only thing that tryptophan can be used to make. And if you're inflamed, if your brain is in an inflammatory state, you aren't going to make serotonin as well. You're not going to make as much. In fact, it might shut it down. And that also shuts down melatonin. So you're not going to have the antioxidant benefits of the melatonin, and you're not going to have the hormonal benefits of melatonin getting you to sleep. So you're not going to sleep right. So all of those things then feedback on one another. And now you have metabolic dysfunction because you're not sleeping right. You're not getting the right lymphatic clearance of all the metabolic waste that's neurotoxic, which leads to more inflammation, and you're on a vicious cycle. Vagus nerve stimulation resets that by blocking the inflammation, restoring synthesis of serotonin, which makes you feel better, makes you happier. And that's the difference between happy and pleasure. I'd rather be happy than have pleasure because I can live without pleasure, but I cannot live without happiness.
Happiness and joy, yeah. The other thing that really blows my mind with this tech is it allows people to take an active role in something that they were told is beyond their control. And so that's a huge part. We're going to do this together. You're going to do most of the work. We're going to prepare the plan, but you're going to execute the plan. So it's not just stop doing that. It's we're going to put this in place or in lieu of, and let's go. And so what's crazy, and this is really good timing, Navas, because if you look at what the Canadian medical groups are talking about right now, it's the diseases of despair and the runaway suicide in the 18 to 34 age group, to the point where they're not calling it suicide, they're calling it a DOD, disease of despair. The end result of uncontrolled immune inflammation and addiction is going to be self-harm. Yet that's all we're seeing in so many age groups right now. And self-harm could be vaping, it could be cutting. Like people, is everybody starting to smoke again? It's not because somebody on Instagram said nicotine's good for you. There's so many other things going on. And so this really gives, what we're all doing with the brain and the autonomic nervous system. This gives us an opportunity to have a major impact in we'll call people's suffering. Because like you said, JP, happiness, man.
Suicide is not a disease of depression. Suicide is a separate condition. It is an anxiety condition. That's why somebody like that football player from the Dallas Cowboys who killed himself, he was in a stressed state. He had just had a car accident or something with his car. He knew he was in trouble. He wasn't depressed. He was very active. He was in a panic state, and that anxiety state led to a suicide. Now, there are plenty of other anxiety conditions that exhibit themselves in self-harm. Some horrific number of girls, I think it's like 25% of teenage girls, will at some point participate in cutting themselves. They're not suicidal, but it's self-harm. Non-suicidal self-harm is a stress condition, and stress conditions can be resolved with parasympathetic recovery and vagus nerve stimulation. That's why one of the studies that I would love to see done, and I'm putting the call out there, is if there are people out there who know somebody who has this problem, who's suffering with this, let's do a study and show that vagus nerve stimulation slows that, prevents that, eliminates that risk. We understand it's not suicide risk, but no parent wants their child cutting themselves or, with a eating disorder. They're all part of an anxiety response. And the world is full of things that are making kids stressed. Phones, social media, all of it.
Trigger.
Every ding of your phone, right? Every driver of that dopamine response that we then become reliant on for our own happy or joy and pleasure experience, not happiness experience, but pleasure experience. And conflating those two is very, very negative or harmful in creating these opportunities for healing. I want to bring our discussion into kind of wrapping it up a little bit and
you
tying a nice bow on this.
Come on.
No, let's not do that.
I want to tie a nice bow on this because I've loved this conversation. It's been really unique. We're very similar in our viewpoints, but I love how you talk about each of these unique pieces to the puzzle and how you discuss these things and just the analogies that you're using. They're just wonderful. Let's talk a little bit and kind of wrap a bow on, and it's a big question, but how does one take those initial steps to unlock their genetic potential? I think one of the big points that we talked about was taking back control and not saying that it's the doctor's decision what I do. It's what I choose to do, and being the empowered self. That's the necessary initial choice that needs to be made. Once somebody's made that decision, they're ready to take back responsibility. What are the first few steps that they can take to engage in upgrading their genetic potential?
That's exactly why people come and see me. When I ask, well, what are your symptoms? They go, oh, I feel great. I just want to be better. So you're looking to upgrade. Okay. So first thing is we look at all the things you're doing day to day that downgrade you. And let's talk about how we repattern that. And then from an upgrade point of view, number one, and it will always be number one, is going to be blood sugar. Going to take a look, not just at your fasting blood sugar. I'm not so worried about that because there's too many influencers with autonomic tone and stress. Let's look at fasting insulin. I got to get that below 5. Now, when you bring that to the forefront and you realize what the hell are you eating every day? Most people just don't understand, the dynamics of macros and food and how we create energy. But when they get a grip on their dysglycemia, when they finally understand that they can train their cells to be in a feeding state and a fasting state, the anti-aging begins, and then the immune system starts to deal with stuff that it's been hanging on to. So we deal with dysglycemia, we create a healthy relationship with food, we clean up the gut, we manage endotoxemia. I am hypersaturating people on ergothioneine and glutathione because if you keep those compounds elevated, bad things won't happen from a detoxification point of view. And I'm talking about viral patterning.
I'll put a plug in for melatonin
And
too.
melatonin, I'm a huge proponent of melatonin, and that dumb study that the media is talking about from People magazine. The author of that says this is not a study, it's a data mine, it sucks, don't read into it. So melatonin is still one of the best primers of NRF2, and that's why we need it to detox in sleep. It's also brilliant for reversing Th17 dominance in children. So if you have autoimmune conditions, you want to look at melatonin. And it's one of my hacks for dealing with electromagnetic sensitivity. But that's just melatonin.
It's also really, really important in the mitochondria because it's one of 3 of the antioxidants
from mitochondria
inside it.
Exactly, and we make it.
I know.
I love stuff that we make. Like everybody's out using cannabis right now, looking for that anandamide hit. We make anandamide, but I don't know how to do that. Like, yeah, but you can. You have it in you. Let's help you get there. And I'm a big fan of plant medicine, but not every day.
Yes.
So these are all the strategies we're working on. I run really advanced brain scanning, HRV trending. We do some biofield stuff. It's kind of like the greatest hits of what I've found work. And then we look at the sleep data and what are we going to do day to day? Remineralize. Everybody's walking around mineral deficient. So hit the greatest hits there. Take a look at what you're doing. Are you drinking? Are you drinking distilled water all day? Are you drinking RO water all day? Those are things we have to look at. And then as we progress, then we might look at hormones, or we might look at organic acids test, maybe not, GI mapping to look at microbiome. But at the end of the day, here's what I'm trying to do. And JP, we started with this using acronyms. I need AMPK and mTOR to have a healthy relationship. You need to be able to do both when you need them. AMPK forward will drive NRF2 up, nuclear response factor. So there's your detox. If NRF2 is going up and active, then NF-kappa B is being pushed down, which is your inflammatory genesis. Mm-hmm. If you can do that, you can be happy. Unfortunately, most people are the opposite. And the medications that they take are actually shutting that down. So when they're using your typical meds, blood pressure meds, cholesterol meds, blood sugar meds, except for metformin, we like metformin, they are actually putting themselves into an inflammatory state. So I guess the number one thing we should all be offering people, if you have the ability to help clients and patients, is just shut up for a minute and listen, ask questions. In my world, I have 3 people do the medical history before I even meet the client. I have 4 different stories, and then I put them all together and tell me more. And the more you can talk to the client, the more they're going to give you. And then you go, oh, yeah, that one time you had Lyme disease, or, you were growing weed in a moldy house up in a 100-mile house or whatever, like people have really cool histories. But there's always a golden pearl. And that once you establish that gold, you unlock that healing pattern that their life's trying to create, even if they've been told they don't have a healthy history or future. You can reestablish that with just a little bit of genetic understanding and a little bit of understanding on how our body creates happiness.
As Hippocrates says, it is more important to know the person who has the disease than the disease that the person has. Just in a nutshell, you got to understand not how long have you had this problem, but what was going on in your life when this problem started. That to me is the trick. You got to know the person. You got to know what's the canvas on which this painting has been laid out. I mean, if it's absorbent, then it's taking in the paint. If it's plexiglass, it's going to just all wash away it's going to drip off. So it's, you're absolutely right. Got to get to know the person, got to get to know the circumstances, got to get to know the underpinning. We do that in counseling of individuals or coaching. You do a round table. You get a perspective about this person's activities and behaviors from all of their colleagues. Well, get a picture of that person from everyone and from all angles, and from internally from all the key ones. You talked about insulin. That's your metabolism. That's your growth versus catabolic state. It's your autonomic nervous system, and your immune system. Those are the four biggies. So that's what we always talk about, the four pillars of health: your microbiome, your immune system, your mitochondria, and your autonomic nervous system.
Yeah, we are engineered to hit it and quit it.
Mm-hmm.
We're not supposed to be hit it all day. You do need a quit point.
That I think the biggest take-home point that I can pull from this is the idea of taking that pause, that we need to build the pause in, and people need to become far more efficient at entering that pause mode and just saying, like, we're stuck in this mode of constantly needing to be productive, and that we need to be producing and doing and building. And we need to learn that taking that pause is actually making you better at building and being productive down the road. You need to learn to pause.
That's why women live longer than men.
Yeah.
Because they know how to pause.
Oh. Well, yeah, we're wired to keep going. And if we're safe, something's wrong.
Yeah.
Yeah. No, it's a psychological construct.
Fascinating study I heard that said that when a man and a woman are sleeping, if the baby cries, the woman wakes up first. But if there's a window open and there's rustling outside, the man wakes up and the woman sleeps through it. Very interesting difference.
Been there both times.
And you're still here to talk about it. I love it.
Yep. No quit in my mind other than the pause. My pause is Lake Superior. I sit on a cliff and just stare in the lake.
That's amazing.
And that needs to happen sooner than later.
I love it. Where can people learn more about you, follow you, and get to know more about how they can work with you potentially?
I'm all over the place. Just, plug me in any search engine or ask chat, or website for the actual clinic system is Innovative Health DRS, as in doctors.com. But hit me up on socials, and watch for this, the Fertile Earth that we are releasing in the spring. Big things coming. I'll get you a landing page, Navaz. I think we've got that done now, but it is in the gestational phase. And it's really exciting because, they took my gloves off and said, do what you got to do. We don't care what it costs. Yeah. So it's pretty magical. And just like making a baby, it's magic.
That's amazing. I have absolutely loved this conversation. I think it's so unique and powerful, and just your approach is so aligned with mine and everything we talk about on the podcast here. So thank you for joining us. Thank you for sharing your brilliance and your insights. We will definitely have you back soon. I'd love to learn more about the Fertile Earth project and everything that comes from that, and how we can implement that into scale and get that to as many people as possible. So we will definitely be having you back at some point. All right.
Appreciate it.
My pleasure. Thank you all for joining. If you got to this point in the podcast, share this episode with I feel like 3 people that need to listen to this podcast. So share it with 3 people who you think could utilize this information to unlock their genetic potential, to take back control of their health. And we will catch you all on the next one.